Beetroot juice has rapidly gained popularity as a natural way to help control blood pressure. More and more people are turning to this vibrant, earthy drink not just for its unique taste, but for its promising health benefits, especially in managing hypertension. With millions affected by high blood pressure, worldwide finding accessible and effective natural remedies is more important than ever. In this video, we'll explore why beetroot juice is considered a game changer in the diet for hypertension. You'll learn what makes this juice special, the science behind how it works, and how it can fit into your daily routine to support healthy blood pressure levels naturally. Beetroot juice is rich in dietary nitrates compounds that your body converts into nitric oxide, a molecule that helps relax and widen blood vessels. This process reduces vascular resistance and lowers blood pressure, offering a natural boost to your cardiovascular system. But is beetroot juice truly as effective as the hype suggests? We'll delve into scientific studies and clinical trials that shed light on its real impact. Along the way, you'll also discover practical tips for incorporating beetroot juice into your life safely, along with any precautions you should be aware of. Understanding how beetroot juice works and its benefits empowers you to make informed choices about your health. Whether you're newly diagnosed or looking for complementary ways to manage hypertension, this video offers valuable insights to help you take control naturally. Let's dive into the powerful world of beetroot juice and see how drinking this natural elixir daily could transform your blood pressure management. Drink number 1. What is beetroot juice? Beetroot juice is a deep red, nutrient-rich beverage extracted from the beetroot vegetable, known scientifically as Beta vulgaris. This vibrant juice has been used for centuries not only as a food, but also for its medicinal properties, particularly its potential to support cardiovascular health and lower blood pressure naturally. The primary nutritional highlight of beetroot juice is its high concentration of dietary nitrates. These naturally occurring compounds are abundant in beets and play a crucial role in the juice's health benefits. When consumed, dietary nitrates are converted by the body into nitric oxide, a molecule essential for maintaining healthy blood vessels. Besides nitrates, beetroot juice contains a wealth of other nutrients beneficial for heart health. It is a good source of potassium, magnesium, vitamin C folate, and manganese, all of which contribute to the regulation of blood pressure and the maintenance of a healthy cardiovascular system. Potassium in particular helps balance sodium levels in the body, which is vital for controlling hypertension. Beetroot juice also boasts betalains, antioxidant pigments that give beets their distinctive red color. Betalains have anti-inflammatory and detoxifying properties, helping to reduce oxidative stress and protect blood vessels from damage. In its natural form, beetroot juice has a distinctive earthy flavor, which some find challenging, but it pairs well with other juices and fruits, making it versatile in recipes. It can be consumed fresh bottled or in powdered form, each offering varying degrees of convenience and potency. Choosing fresh, organic beetroot juice ensures maximum nitrate content and minimal additives, enhancing its effectiveness as a natural remedy. However, it's important to be mindful of portion sizes and frequency of consumption to avoid any potential side effects. In summary, beetroot juice is a nutrient-dense drink rich in dietary nitrates and antioxidants, making it a powerful natural option for supporting healthy blood pressure and cardiovascular function. Drink number 2. How beetroot juice helps lower blood pressure. Beetroot juice's ability to lower blood pressure naturally is primarily due to its rich content of dietary nitrates. These nitrates play a vital role in the body's cardiovascular health through a complex biochemical process that results in the production of nitric oxide, a powerful molecule known for its vasodilatory effects. When you consume beetroot juice, the nitrates are absorbed in the digestive system and enter the bloodstream. Here, bacteria in the mouth convert these nitrates into nitrites, which are further converted into nitric oxide in the stomach and bloodstream. Nitric oxide acts as a signaling molecule that helps relax and widen the blood vessels, a process known as vasodilation. This relaxation reduces the resistance in the blood vessels, allowing blood to flow more easily and thereby lowering blood pressure. This mechanism is crucial because high blood pressure is often caused by the narrowing and stiffening of arteries, which increases resistance to blood flow. By promoting vasodilation, nitric oxide helps counteract this effect, reducing the workload on the heart and lowering the risk of cardiovascular complications. In addition to vasodilation, nitric oxide also has anti-inflammatory properties and helps reduce oxidative stress, both of which contribute to the overall health of the vascular system. Chronic inflammation and oxidative damage can impair blood vessel function and are common contributors to hypertension and other cardiovascular diseases. Moreover, beetroot juice supports endothelial function. The endothelium is the inner lining of blood vessels responsible for producing nitric oxide and maintaining vascular tone. In hypertension, endothelial dysfunction is common, leading to reduced nitric oxide production. Regular consumption of beetroot juice has been shown to improve endothelial function, thereby enhancing the body's natural ability to regulate blood pressure. Another benefit of beetroot juice is its potential to improve arterial stiffness, a condition where blood vessels lose their elasticity. Increased arterial stiffness is linked to higher blood pressure and cardiovascular risk. Nitric oxide produced from dietary nitrates helps maintain the flexibility of blood vessels, improving overall vascular health. Beetroot juice may also influence other factors related to blood pressure control, such as reducing sympathetic nervous system activity, which is often overactive in people with hypertension, and improving kidney function, which plays a key role in fluid and sodium balance. The effects of beetroot juice on blood pressure are dose-dependent and can be observed within hours of consumption. Studies suggest that even a small daily amount of beetroot juice can lead to meaningful reductions in both systolic and diastolic blood pressure, especially in individuals with elevated or stage 1 hypertension. However, individual responses can vary due to factors such as genetics, diet, oral microbiome composition, which affects nitrate conversion, and overall health status. Despite these variations, the vasodilatory and endothelial benefits of beetroot juice provide a solid physiological basis for its use as a natural blood pressure lowering agent. In summary, beetroot juice helps lower blood pressure by supplying dietary nitrates that the body converts into nitric oxide, promoting blood vessel relaxation, reducing inflammation, improving endothelial function, and enhancing overall vascular health. This multifaceted mechanism makes it an effective and natural option for managing hypertension. Drink number 3, scientific evidence supporting beetroot juice. Scientific research over the past decade has increasingly supported the benefits of beetroot juice in managing hypertension, providing a strong evidence base for its use as a natural remedy for high blood pressure. Numerous clinical trials and meta-analyses have examined its effects, demonstrating promising results that have captured the interest of healthcare professionals and the public alike. One of the earliest and most influential studies was conducted in 2008, showing that a single dose of beetroot juice could reduce systolic blood pressure by approximately 410 nm marks within hours of consumption. This was a groundbreaking finding, highlighting the rapid impact beetroot juice can have on vascular function. Since then, many studies have replicated these findings, confirming beetroot juice's ability to produce acute reductions in blood pressure. A significant body of research has also focused on the long-term effects of regular beetroot juice consumption. Studies lasting from a few weeks to several months have shown that daily intake of beetroot juice can sustain lower blood pressure levels, particularly in individuals with elevated blood pressure or stage 1 hypertension. These sustained effects are important because they suggest that beetroot juice can be part of a daily lifestyle intervention for managing hypertension. Meta-analyses, which pool data from multiple studies, provide comprehensive evidence of beetroot juice's efficacy. One such meta-analysis published in 2017 reviewed several randomized controlled trials and concluded that dietary nitrate supplementation from beetroot juice significantly reduced both systolic and diastolic blood pressure compared to placebo. The reductions, while modest, are clinically meaningful and comparable to some antihypertensive medications, especially when used as part of a broader lifestyle approach. The research also indicates that beetroot juice is most effective in individuals with high blood pressure, rather than those with normal blood pressure, making it a targeted intervention. Its effects tend to be more pronounced in people with stage 1 hypertension, suggesting that beetroot juice could serve as a complementary treatment to prevent the progression of hypertension. Beyond blood pressure, some studies have explored beetroot juice's effects on arterial stiffness and endothelial function, two important cardiovascular health markers often impaired in hypertensive patients. Improvements in these areas were noted, further supporting beetroot juice's role in vascular health. Importantly, most studies report that beetroot juice is safe and well tolerated with few adverse effects. Some individuals may experience beeturia, a harmless condition where urine turns pink or red after consuming beets. Others may notice mild gastrointestinal discomfort if consuming large amounts, but these side effects are generally rare and mild. Despite the growing evidence, researchers note that individual responses to beetroot juice can vary. Factors such as diet oral bacteria, which convert nitrates to nitrites genetics, and gut health influence its effectiveness. Nonetheless, the overall consensus in the scientific community supports beetroot juice as a beneficial natural adjunct for blood pressure management. To summarize, a robust body of scientific evidence supports beetroot juice's ability to lower blood pressure naturally. Both acute and long-term studies demonstrate meaningful reductions in systolic and diastolic blood pressure, particularly in hypertensive individuals. With its safety profile and additional cardiovascular benefits, beetroot juice stands out as a promising science-backed natural remedy for hypertension. Drink number 4. How to incorporate beetroot juice into your daily routine. Incorporating beetroot juice into your daily routine can be a simple yet effective way to naturally manage high blood pressure and support cardiovascular health. To maximize its benefits, understanding the best practices for consumption dosage and preparation is essential. Choosing the right beetroot juice. First, select high-quality beetroot juice to ensure you're getting the maximum amount of beneficial nitrates and nutrients. Freshly squeezed beetroot juice from organic beets is ideal as it contains the highest nitrate concentration without additives. If fresh juice isn't available, look for cold-pressed 100% pure beetroot juice without added sugars or preservatives. Beetroot juice powder is another convenient option, offering longer shelf life and easy portion control. However, check that the powder is made from pure beetroot and does not contain fillers or artificial ingredients. Recommended dosage. Scientific studies often use doses ranging from 250 milliliter, about 1 cup, to 500 milliliters daily to achieve blood pressure lowering effects. For those new to beetroot juice, starting with a smaller amount such as 100 to 150 milliliters and gradually increasing allows your body to adjust and helps minimize potential side effects like gastrointestinal discomfort. Daily consumption is recommended for sustained benefits. Drinking beetroot juice consistently over weeks to months has been shown to maintain lower blood pressure levels. Incorporating it as part of your morning routine or before exercise can be particularly effective due to its vasodilatory effects and potential to enhance physical performance. Timing matters. The timing of consumption can influence effectiveness. Drinking beetroot juice 2 to 3 hours before activities that require increased blood flow, like exercise, can improve endurance and performance. For blood pressure management, consistent daily intake at a similar time helps maintain steady nitric oxide levels. Avoid consuming beetroot juice late in the evening to prevent potential disruptions in sleep, as it may cause mild stimulation in some individuals. Preparation. Tips. If you're making beetroot juice at home, wash beets thoroughly and use fresh, mature roots for the best nitrate content. Combine beets with other vegetables or fruits like carrots, apples, or ginger to enhance flavor and nutritional profile. Store fresh beetroot juice in a sealed container in the refrigerator and consume within 24 to 48 hours to retain nutrients. Potential interactions and precautions. While beetroot juice is generally safe, it can interact with certain medications, especially those affecting blood pressure or blood thinning. Consult your healthcare provider before starting regular consumption if you are on medication. Be aware of beeturia, a harmless but startling pink or red discoloration of urine or stool after consuming beetroot. This effect is normal and not a cause for concern. If you experience any digestive discomfort, reduce the amount consumed or dilute the juice with water. Making beetroot juice a habit. Incorporate beetroot juice into your diet gradually and consistently for the best results. Pair it with other lifestyle changes such as a balanced diet, regular exercise, stress management, and medication adherence to optimize blood pressure control. Some people find it helpful to set reminders or incorporate beetroot juice into meal prep routines to maintain consistency. In summary, daily consumption of high-quality beetroot juice in recommended amounts, timed appropriately, and prepared mindfully can be an easy and natural addition to your hypertension management strategy. Drink number 5. Potential side effects and precautions. While beetroot juice offers numerous health benefits, especially for blood pressure management, it's important to be aware of potential side effects and precautions to ensure safe consumption. Common side effects. One of the most noticeable but harmless side effects is beeturia, where urine or stool turns a reddish or pinkish color after consuming beetroot juice. This occurs in about 10 to 14% of people and is simply due to the pigments in beets passing through the digestive system. Though alarming in appearance, beeturia is harmless and does not indicate any health problem. Some individuals may experience mild gastrointestinal discomfort, such as bloating gas, or an upset stomach, particularly when first introducing beetroot juice or consuming it in large quantities. Starting with small doses and gradually increasing intake can help minimize these effects. Blood pressure considerations. Because beetroot juice has a potent blood pressure lowering effect, those already on antihypertensive medications should consult their healthcare provider before adding beetroot juice to their regimen. Combining beetroot juice with medication may cause blood pressure to drop too low. Hypotension, leading to dizziness, fainting, or other complications. Monitoring blood pressure regularly is advisable when starting beetroot juice to assess how your body responds, and to adjust medication if necessary, under medical supervision. Kidney stone risk. Beetroot is high in oxalates compounds that can contribute to kidney stone formation in susceptible individuals. If you have a history of oxalate kidney stones or kidney disease, it's important to discuss beetroot juice consumption with your healthcare provider to avoid potential risks. Interactions with medications. Beetroot juice may interact with certain medications, including blood thinners and nitrates used for heart conditions. These interactions could affect drug efficacy or increase side effects. Always inform your doctor if you plan to consume beetroot juice regularly. Pregnancy and breastfeeding. Research on beetroot juice consumption during pregnancy and breastfeeding is limited. While beets are generally safe as food, concentrated juice intake should be discussed with a healthcare professional during these periods. Allergies. Though rare allergic reactions to beetroot can occur, symptoms may include itching, swelling, or difficulty breathing. If you experience any allergic symptoms after consuming beetroot juice, seek medical attention immediately. Quality and storage. Consuming high-quality fresh beetroot juice is important to avoid exposure to contaminants or added sugars found in some commercial products. Store fresh juice in airtight containers in the refrigerator and consume within 24 to 48 hours to maintain freshness and nutrient content. General recommendations. To minimize risks and maximize benefits, start with small amounts of beetroot juice and monitor your body's response. Maintain open communication with your healthcare provider, especially if you have existing health conditions or take medications. In conclusion, while beetroot juice is generally safe and effective for lowering blood pressure, being mindful of potential side effects and consulting healthcare professionals ensures its safe and beneficial use as part of a natural blood pressure management plan. Beetroot juice stands out as a powerful and natural ally in the fight against hypertension. Its rich nitrate content, which converts into nitric oxide in the body, helps relax and widen blood vessels, leading to lower blood pressure and improved cardiovascular health. Backed by a growing body of scientific research, beetroot juice offers a safe, accessible, and effective option for those seeking to manage high blood pressure naturally. Incorporating beetroot juice into your daily routine, when done thoughtfully and with attention to dosage, can provide sustained benefits. Whether you choose fresh juice-bottled varieties or powders, consistency is key to harnessing its full potential. Alongside a balanced diet, regular exercise, and medical care, beetroot juice can be a valuable part of your hypertension management strategy. While generally well tolerated, it's important to be aware of possible side effects such as bacteria and gastrointestinal discomfort, and to consult your healthcare provider, especially if you're on blood pressure medication or have underlying health conditions. This ensures you can enjoy the benefits safely and effectively. At Active Healthcare, we are dedicated to bringing you evidence-based insights and practical tips to empower your journey toward better health. If you found this video helpful, please like, share, and subscribe to our channel for more expert advice on natural ways to manage hypertension and enhance your well-being. Remember, taking proactive steps through diet and lifestyle changes, like adding beetroot juice daily, can make a significant difference in your blood pressure and heart health. Start today and take control of your wellness naturally.